Good afternoon, everyone. This afternoon we will be taking a look at the reports for the colonoscopy episode. PAPS will provide tools to help measure and improve patient care. One of the most important tools is the provider reports. These reports are key to keeping up with your performance relative to each episode and show your eligibility for gain or risk sharing. The reports provide performance information for PAPS episodes, such as an overview of quality across the PAPS episode, an overview of cost effectiveness, how a PAP is doing relative to cost thresholds and relative to other providers, and an overview of utilization and drivers of a PAPS average episode of cost. PAP performances reports have summary results and detailed analysis of episode cost, quality, and utilization. The guide to reading your reports is available online, as well as the reports. They're available via the provider portal. Reports will be issued quarterly. The delay between the reporting period and the availability of reports on the provider portal is due to the time required for claims to be submitted for services provided. It will be 3 months for 95% of the claims, and the time required for claims algorithms and quarterly reports to be processed is 1 month. Let's look at the first page of the report. The first page of the report will give you the date of the report and the date range of the data included in the report. It will also tell you if this is a historical report or an actual performance report. Please note the disclaimer at the bottom of the page, which states the information contained in this report is intended solely for the use of administration of the Medicaid programs. The data in the reports is neither intended nor suitable for other uses, including the selection of a health care provider. The figures in the reports are preliminary and are subject for revision. For more information, please visit our paymentinitiative.org website. The second page is a letter from Andy Allison, our Medicaid director. There is a lot of useful information in this letter regarding the Arkansas Payment Improvement Initiative, so I would encourage everyone to read this letter. The one section that I would suggest you look at in the letter would bring attention to the fourth paragraph. On the fourth paragraph, the first sentence will tell you whether this is a report in the preparatory phase or the actual performance phase. I realize that you're starting to view many of these reports, and sometimes it's a little hard to keep them straight, so this is another way that you can be sure what you're looking at is actual historical or actual live performance data. The third page of the report is the table of contents. This page will list all episodes for which you are considered the printable accountable provider or the PAP. The first page of the report is going to look a little different from the earlier reports that you received in the performance summary. I believe it's a little easier for you to read at a glance. And again, it will list all episodes for which you are considered a PAP. Going across the top columns, it shows the episodes of care. The next column, you will have your quality. It will show whether you met or not met the episode. The next one would be your average episode cost. It will show acceptable, non-acceptable, or commendable. Then you will have your gain and your risk sharing column. This will show whether you are eligible for gain sharing, will receive gain sharing, or will be subject to a risk sharing. The last column will show the amount. That's your amount that you will have in the last amount. If you are subject to risk sharing, it will be highlighted in red. Please note that the last line of this page, it gives you a summary of your gain, risk sharing across all episodes for which you are a PAP and tells you if stop loss was applied. The next slide is going to be your summary page. This will be the same format for all of the Wave 2 episodes. The first section is the overview, which shows the total number of episodes being 262. The total number of episodes included shows 233, and the total number of episodes excluded, it shows 29. The second section shows the cost of care compared to providers ranging from commendable to acceptable. The individual providers will be indicated with a dark blue diamond. It will show the gain or risk share for each episode. The third section of the quality summary, on one side of the black line will be a graph or graphs depending on the quality metrics for each episode. These quality metrics are the ones being linked to gain sharing. If the episode requires quality data to be entered into the portal, it is very important that you enter the required data into the portal, as even if you are in the commendable range and do not meet quality metrics, you are not eligible for gain sharing. In this episode, you are required to enter quality metrics into the provider portal. On the other side of the center black line will be your quality metrics that are not being tracked to gain sharing. Now, when we get to the fourth section, it's going to go across the cost summary. There will be several graphs in this section of the report that will be useful to you in accessing your performance. The first one is going to be your adjusted cost compared to your total adjusted cost. The graph next to it is the average cost overview and compares your average cost to other providers. In this graph, the provider's average cost is just a little lower than the other providers, but is still in the acceptable range. The graph in the middle of the section shows you the cost distribution. In this example, the provider had 23 beneficiaries in the $756 through $796 cost range, which is in the commendable. The provider also had 23 beneficiaries in the $886 range through $2,038 cost range, which is in the non-acceptable range. The provider also had 84 beneficiaries in the $826 to $856 cost range, which was acceptable. So look closely at this graph on your report. It will help you see whether majority of your beneficiaries are falling, and maybe take a closer look at the ones falling in a higher cost range. The last graph of this section shows where the provider will fall in the distribution range of the provider average cost. The provider is shown with the blue line. Now on this graph, it's kind of hard to see, but on your reports it will be a dark blue line, and it's usually right in here, or it'll be a dark blue line. So I do apologize if it's hard to see on this graph. The next section will be the fifth section of this page, the fifth section of this page here, and it shows the key utilization metrics, which may vary according to the episodes of care. For this episode, we are looking at the anesthesiologist rates. This gives the provider a look at how they are performing in relation to other providers and where they may have areas of opportunity for improvement. And the colonoscopy reports were published on or before will be published on or before July 31st and are available to view on AHAN. The next slide is the quality and utilization detail, which shows the provider what percentile they fall in relation to quality and utilization metrics. Notice the highlighted line in section 1. This is the quality metric that is linked again to the share, and the provider would have to be over the black bar in order. It's not highlighted here, but the provider would have to be over the black bar in order to participate in the gain sharing. The last page of the report we're going to look at is the cost detail. Like previous reports, it will break down the cost categories associated with episodes of care. This gives the provider the opportunity to see where they are in relation to other providers, where are they going, and how they're doing well, and also where they may have areas where they can put some improvement. The glossary of the terms will still be in the reports, as well as the detailed reports that shows all beneficiaries included in the episodes, broken down by number of claims and cost categories. The beneficiaries excluded from the episode will not be included in the detailed report.
And just to add to that, that last slide that's on the screen right now, in other episodes has been one of the more valuable slides, because it is one of the first times that PAPs have seen total resource expenditure for their patients, because in many of these episodes it includes costs that go beyond just what you have ordered. So it can be extremely useful to compare yourself to your peers and to how your patients journey through the healthcare system while receiving the service you're providing.